And good morning, everyone. Welcome. Thank you for joining us today for the Knockout Opioid Abuse Day Learning Series webinar, Knockout Opioid Abuse Day, Looking Back and Looking Ahead. So for those of you who are joining us, Knockout Opioid Abuse Day is held in New Jersey every year on October 6th, and it's a way to bring attention to the opioid crisis on that date and throughout the month. And so this learning series has developed through that desire to continue to shine a light on the opioid crisis and solutions that we can all be part of as we work to solve that crisis. I have quite a few housekeeping items to go through today with you. Today's webinar is designated for one AMA PRA Category 1 credit, one ANCC contact hour, one ACPE contact hour, one AAPA Category 1 CME credit, and one ADA CERP continuing education credit by the American Academy of CME Inc. And for any pharmacist claiming credit, please note that your credit will be uploaded to the CPE monitor within 30 days. This webinar has also been approved by New Jersey OEMS for one EMT elective CEU, and the program is designated for Certified Health Education Specialists and/or Master Certified Health Education Specialists to receive up to one total Category 1 continuing education contact hour. And this course has been approved by the New Jersey Board of Optometrists for one regular credit. It has also been approved for one continuing education credit by the New Jersey Social Work Continuing Education Approval Collaborative, which is administered by NASWNJ. The Partnership for a Drug-Free New Jersey is approved by the Board of Certification, Inc. to provide continuing education to athletic trainers, and this program is eligible for a maximum of one Category A hour or continuing education unit. PA Planner Dane Barone discloses that he serves on the speakers bureaus of Ethicon and Johnson & Johnson, and all other planners, faculty, and reviewers have no relevant financial relationships to disclose. All relevant financial relationships have been mitigated. So today's webinar is jointly provided by the Partnership for a Drug-Free New Jersey and the American Academy of CME Inc. and is being held in collaborations with NJ Cares, the New Jersey Office of Alternative and Community Response, and the New Jersey Office of the Attorney General, and the Opioid Education Foundation of America. So I welcome all of our attendees who are here with us today, and I am so pleased to welcome today's expert faculty, Dr. Christopher Jones, Director of the Center for Substance Abuse Prevention at the Substance Abuse and Mental Health Services Administration. Dr. Jones, we'll turn the presentation over to you. So pleased to have you with us today.
Great. Thank you so much. Let me just pull up my slides. Angela, always appreciate the partnership and good to see you. And welcome to all the attendees. Great to be here with you today. I want to just briefly outline what I'll be covering during the presentation. First, really just helping to set the landscape of the epidemiology of substance use. Where are we with substance use and overdose? Talk about putting prevention work in that context of what is happening in the substance use space, as well as the continuum of care. Talking about how we can continue to build prevention strategies to address the epidemic of substance use in the U.S. and talk about a comprehensive prevention strategy. So I will get started with foundational understanding.
So Dr. Jones, I'm just going to interrupt you for a minute. We're having just a little bit of issue with your sound.
Okay.
So I'm not sure if you're a little far away, or just wanted to give you a heads up on that.
Is it any better?
It is much better now.
Who knows?
Okay.
Technology.
Exactly.
Let me know if
Technology.
if it goes in and out, let me know.
Okay, we'll do.
All right, thank you. So yes, a little bit of emphasis on the current substance use challenges. So first, just on overdose deaths, just to give a historical perspective of where we are and where we've been. And really since the late 1980s, we have been on an upward trajectory of overdose in the US with a couple of years here where we saw small declines. And then really during the first couple of years of COVID, we saw pretty extraordinary increases.
I'm sorry to interrupt you again. We are just not understanding you. Maybe if you turn off your video, you'll have a stronger sound, perhaps. It's just every word is kind of getting scrambled a bit.
Let me change my source. Let's see.
Is this any better?
Yes, it's clear.
Okay,
All right.
give it a shot.
Thanks.
Yeah, so if you heard every other word, then that made no sense what I just said. But essentially, we have really seen historic increases in overdose deaths in recent years, especially during the first couple of years of the COVID-19 pandemic. But more recently, provisional data from CDC, first in 2022, showed really sort of a plateauing of overdose deaths in the US. And then the projections for 2023 for about a 3% decline in overdose deaths. Obviously, we're still at very historically high levels of overdose, but anything that's not an increase is certainly very welcome, given the significant increases we saw over the last several years. These are the latest data from CDC comparing the 12 months ending in April of 2023 to the 12 months ending April 2024. And you can see here that at a national level, CDC's provisional data predict about a 10% decline in overdose deaths during those two time periods, comparing those two time periods. And the states in blue are those that are experiencing decreases. Darker blue represents larger decreases over that time frame. States that are in orange reflect states that are reporting increases over this time frame. So you can see here, it's not evenly distributed. Some states are experiencing greater declines than others, and about 10 states are actually continuing to report increases during this time period. But you can see pretty much mid-Atlantic Northeast, it's pretty consistent with the exception of Washington, D.C. And then most of the increases are happening more in the West Coast, and much of that is related to a westward expansion of fentanyl that came much later for Western states than Eastern states. But again, if you looked at this in more granular levels within a state, you would also see variability. Some areas continue to experience burden in ways that other areas of a state are not experiencing that. And when we look at the particular drugs that are involved in overdose deaths, again, we've seen a shift over the last decade from prescription opioids to heroin to illicit fentanyl and other synthetic opioids, resurgence of stimulants like methamphetamine. And we see from CDC data that the vast majority of overdose deaths involve opioids, stimulants, or opioids and stimulants. And those are primarily illicit fentanyl, fentanyl analogs, other synthetic opioids, with about less than 4% of overdose deaths not involving opioids and or stimulants. And you can see here about a quarter of those deaths involve illicitly made fentanyl with no other opioid or stimulant. And then you start to see combinations, fentanyl and cocaine, fentanyl and methamphetamine, et cetera. But very few deaths don't involve either of those synthetic opioids or stimulants. So very much have shifted from a prescription-based driver of overdose deaths to illicit synthetic substances. And with some of those shifts, we've continued to see a bit of a changing epidemiology of overdose as far as who's impacted. These are data over the last 6 years. The 2023 data are not final yet. They're the latest provisional data. But again, we see over the whole time period that everybody has experienced some level of increase. But in more recent years, we've seen some declines in certain groups, but continued increases in others. So when we look at race ethnicity, we see, again, large disparities with non-Hispanic Black, non-Hispanic American Indian, Alaska Native populations, and in fact, continued increases projected in those populations, whereas with non-Hispanic white populations, we actually see some declines over the last couple of years. Similarly, for age groups, we see sort of like young adults through middle-aged adults tend to be seeing declines, but on the tails, whether it's really younger people, adolescents, youth, or older adults, we actually see some increases for 2023. And so this is important because we think about where are we deploying strategies, who are the populations that we're engaging with, how are we thinking about resource allocation, where are we sending naloxone and other opioid overdose reversal medications, how are we engaging people in treatment for opioid use disorder, providing buprenorphine or methadone or naltrexone, really thinking about where are those populations that are being missed. Is it really important, and using data to help drive those decisions. And taking a little further look, in particular at youth and young adults, we also see similar disparities playing out. Again, declines in some race ethnicity groups, continued increases in others. And again, depending on your populations of focus and who you're working with, these types of data are really helpful in making sure that you are really engaging with the populations who are most impacted. But all of this is really being driven by a very toxic, unpredictable illicit drug supply. And even though fentanyl has been in the drug supply for over a decade now, we continue to see shifts. Other synthetic opioids emerging, synthetic benzodiazepines, xylazine has emerged in the last several years in many parts of the country. Just continued changes in the substances that people are exposed to in an increasingly toxic drug market. And much of the spread of fentanyl has been facilitated by counterfeit pills that look like commonly misused prescription drugs, like Xanax or oxycodone or 30 milligram oxycodone tablets, but in fact include lethal amounts of fentanyl. And I think that's been a particular driver in deaths among young people who are very early on, maybe in their substance use, don't have a substance use disorder, think they're taking something from a friend and they're actually getting, a toxic amount of fentanyl. We've also seen some shifts in patterns of drug use. CDC put out a report last year that found that there's been a shift from injection to smoking as a predominant route of drug use among people who are dying. So as we think about how are we engaging with people who use drugs, we have, longstanding syringe services programs in many communities throughout the country, but people who smoke drugs may not think of themselves as, going to SSPs because they don't inject. But it's important that we message that SSPs have many other supplies, including supplies that can reduce risk for smoking, but also things like naloxone, opioid overdose reversal medications, fentanyl test strips, xylazine test strips, connections to treatment and recovery support services, other wound care, infectious disease. So really, regardless of route of use, these can be particularly important for people who use drugs. And when we zoom in a little bit on just the overall patterns of use, because we do focus a lot on the overdose deaths, but when we look at overall patterns, we continue to see that alcohol, nicotine, and marijuana are the most commonly used substances by far compared to either prescription drug misuse or other illicit substances. And that holds for youth 12 to 17, as well as young adults 18 to 25. And you can see here, again, significantly higher prevalence in those age groups for marijuana, nicotine, and alcohol. And so as we think about broader prevention beyond overdose prevention, we have to appreciate that our efforts have to be holistic, really addressing the substances that people are using most often, in addition to expanding our work around overdose prevention. And the other part I wanted to raise around youth substance use in particular, as we think about prevention, is that youth substance use isn't happening in a vacuum. So often when youth are using substances, they're using multiple substances, typically combinations of alcohol, nicotine, and marijuana. But you can see on the left-hand part of this slide, prevalence rates for other substances among youth who used alcohol in the past year or youth who used marijuana in the past year. But you can see 2/3 reported alcohol use, about 71% reported nicotine use among those who used marijuana in the past year. But it's also important that we really elevate the other things that are going on in young people's lives as we think about how do we approach our prevention work. So first, we know that young people who are struggling with mental health challenges have higher rates of substance use, whether it's illicit drugs, marijuana, alcohol, nicotine. We see across the board that kids who are struggling with mental health challenges like depression report higher rates of substance use. Data that were released just a couple of months ago from CDC's Youth Risk Behavior Survey also, I think, put an important spotlight on other challenges that young people are facing that are very much connected to substance use prevention. So about 45% of high school students reported that they didn't feel close to someone at school. 40% said they persistently had feelings of sadness or hopelessness. 29% poor mental health, 20% seriously considered suicide. And then, important minorities of high school students reported that they experienced bullying. They didn't go to school because of safety concerns, and about 1 in 10 said they had experienced sexual violence. And we know that those types of exposures are all linked to risk for substance use. So as we think about our prevention efforts, it's really looking at young people in a holistic way. How are we creating environments that are safe and supportive to not only benefit reducing substance use and substance use related harms, but also to address these other contextual factors and risk factors that are playing out in their lives every day. We see the same thing for adults. Again, adults that have any mental illness in the past year or serious mental illness in the past year report higher rates of substance use. So as we think about how are we approaching treatment, addressing underlying and co-occurring conditions is a really important part of reducing substance use impacts. CDC also did a recent analysis looking at mental health disorders among people who died from a drug overdose. And again, we see that there are many opportunities for intervention with people who have mental health disorders who died from an overdose compared to those who did not. So again, these are very much interlinked issues, although historically they have been viewed as somewhat separate. And if we think about sort of the mental health treatment system and the substance use treatment system, they have not always been integrated, much less integrated with physical health as well. So again, taking a holistic approach to really understand what's going on with individuals really helps, if you're practicing as a clinician, helps set a positive path for really addressing those underlying issues that are contributing to risk. And then the last thing I'll say on the data piece, and this is from a paper we did a few months ago that came out, is that we really are now, given that we're multiple decades into the overdose crisis in the US, we are seeing the multi-generational impacts of overdose. In this paper, we estimated the number of kids who'd lost a parent to drug overdose, and that was about 320,000 kids in the US over the past decade had lost a parent to overdose. And we know that death of a parent and that instability that can happen in a child's life can be a very important risk factor for future substance use and sort of these generational cycles where we may miss opportunities for prevention. But we know that these longer term trends are very much connected to the economic and other stressors that are playing out in homes and communities. And if we're really going to have the long-term impact that we want, we have to address this in a holistic way. So that leads us to how are we thinking about this work at SAMHSA, and how can we be partners in our efforts with what you're doing in communities? So in the Center for Substance Abuse Prevention, we aim for a future where individuals, families, and communities are healthy and thriving. That's the goal. That's where we want to get with our prevention work. A byproduct of that is that substance use and substance use related harms will go down. But ultimately, we're looking at things like resilience, positive relationships, positive and stable environments to achieve that ultimate vision. And in our prevention work, we don't just focus on preventing initiation in the first place. That's a core part of our work, but we also want to prevent progression of substance use and prevent and reduce substance use related harms. And we want to do this in data-driven, equity, and culturally informed ways. And as we think about our prevention work, I covered sort of with the overdose deaths, sort of a lot of negative trends in a sense. We've been dealing with a crisis over the last 2 decades that has been relentless in communities and heavily impacted communities. But one thing that I think we don't talk enough about is that we've actually seen declining substance use patterns among youth over the last several decades. And that is something I think we really need to celebrate, that youth substance use rates are going in the right direction. This slide has data from the Monitoring the Future study, which is an NIH study done every year among 8th, 10th, and 12th graders. And you can see here, whether it's alcohol, any illicit drug use, cannabis use, or illicit drugs other than cannabis, we see this downward trajectory over the past 20 years. The darker red color represents 2020, sort of COVID, peak COVID period, where we saw large drops that have largely been maintained in the post-COVID environment. Even as society has gotten back to normal, people are back in school, those downward trends have continued. And then CDC released data from YRBS through 2023 that also showed similar trends, downward trends in youth substance use. So we certainly want to capitalize on this progress. And so I think it's an important motivator that we are making progress. Despite what we see in the overdose space, we are making progress in the overall prevalence of substance use. But again, it really is, how do we balance that we're making progress here, but among people who are using substances, there's greater risk for harms, including overdose, than there has ever been because of the toxicity in the illicit drug supply. So we really have to take a comprehensive approach that not only addresses the longer term upstream risk and protective factors, but also focusing on addressing the acute urgency of overdose. And as we look at some of the data, while much of our prevention work often focuses on youth, because that is a typical time period of development where individuals are initiating substance use for the first time, we see from our National Survey on Drug Use and Health that many people who are adults are also initiating different substances in the past year for the first time. We see that for alcohol, marijuana, cigars on this particular slide. And we see similar patterns for nicotine vaping, where almost 2/3 of individuals vaped nicotine for the first time at age 21 or older. And as we look at other illicit substances like methamphetamine or heroin, we see average ages of initiation well into the mid-20s. And so we do have to think about prevention opportunities across the lifespan as people are moving through different stages of life, say transition age youth who are going from high school to a college or early adulthood environment. How are we helping to support a healthy transition? How are we thinking about prevention in that context? And as people retire and they have their social networks have impacts, and people get older and they have less mobility, they have more physical problems. How are we thinking about prevention in that space as well? There are many opportunities to engage in prevention. So regardless of where you sit in a clinical setting, in a community setting, it's important to know that prevention is not just for youth, but that there are opportunities to bolster protective factors and address risk factors across the lifespan. The other piece I wanted to really note, and as I've been working in the prevention space for many, many years, and certainly have traveled across the country, we often have sort of a bifurcated way of looking at prevention and treatment. That prevention's job is to prevent initiation, but if people are using substances, they need treatment. And what we see in the data is that that's not really true. There are a lot of people who are using substances who don't actually meet diagnostic criteria for a substance use disorder. And so that group of individuals is certainly at risk for substance use related harms, but also progression to a substance use disorder. And I see it as a really important part of our prevention work is how are we engaging with those populations? We don't want to set up a prevention system that basically says, we're focused on initiation, but once you've crossed that threshold, you're on your own until you need treatment. We really need to be thinking about it, that there is a large pool of individuals who are using substances, potentially in unhealthy and harmful ways, that we have preventive interventions that we can engage on. Maybe it's economic stressors, maybe it's underlying mental health challenges, maybe it's interpersonal challenges that somebody is experiencing, but we have interventions, whether they are medical or non-medical interventions, to assist individuals on a healthier path. I think this is a particularly important data point to really underscore that there are a lot of people that if we're not focusing on prevention, they may progress to a use disorder or certainly may experience substance use related harms. And we even see this among people who report injection drug use in the past year. Again, conventional wisdom might suggest that people who are injecting drugs have a use disorder, but we see across people who reported use of different substances who also reported injection drug use in the past year, again, many of those people located in blue here did not actually have a use disorder. So again, there are opportunities for prevention across the continuum of substance use. And we see with the overdose data that, again, there are opportunities for acute response efforts that are being missed. Whether it's looking at young people, which is the bottom portion of this figure, or overall people who died from an overdose, we see that, one, things like social determinants of health are prevalent among those individuals experiencing homelessness or housing instability. And by and large, the vast majority of people who died from an overdose have no evidence of naloxone administration, despite a bystander often being present. And in many cases, even though a bystander was present, somebody in the home, somebody knew that the individual was using substances, no action was taken by the bystander to respond to the overdose. So again, as we see some progress being made in the overdose space, we still have a lot of opportunity to help people understand overdose prevention and response, how to use naloxone and other opioid overdose reversal agents, and how to have sort of build confidence and self-efficacy among individuals who are around others who are using substances to be able to engage and save a life. But again, we see that same pattern even when we look at young people, where bystanders were present. Among 10 to 14-year-olds, 80% of the time a bystander was there, but in that context, 2/3 of them did not take an action to save a life. And you can see about 30% of those individuals had naloxone, evidence of naloxone administration. And when we look at broader opportunities for prevention, we have been making progress, but we certainly have opportunities. So one of the data points that I think is like a good thing that young people report is that almost 95% of young people said that they had someone to talk to about their problems. That's very good. I would love to see that at 100%, but that's a good thing. We know that having some other positive adult role model or outlet to engage is a protective factor. We also see from our National Survey on Drug Use and Health that about 83% of kids said that their parents told them in the past year that they had done a good job on something or that they were proud of them for something that they had done. Again, that's very good. We know parents are an important influencer of youth. But that also means that about 1 in 5 kids, or 20% of kids, said their parents didn't tell them that they were proud of something that they had done or they had done a good job. So again, helping parents understand the importance of their words in communication with kids is really, really important. We have opportunities to improve there. When we start looking at some of the substance use specific messaging or programming, we see about 50% of 12 to 17-year-olds in the US said that their parents had talked to them about the risk of substance use in the past year. So again, we have a lot of room for improvement there. But about 2/3 of kids said that they heard messages around substance use prevention either in school or outside of school. So again, that's good. We're reaching 2/3 of kids, but that also means 1/3 of kids said they didn't hear that. Where we have even more room for improvement is exposure to prevention programming, whether it's in school or outside of school. Again, we see much smaller percentages of kids who report that they participated in some type of problem solving, self-esteem communication skills program, or substance use or violence prevention program in the past year. So as we think about our prevention work, one of the areas that we've really been trying to sort of widen the lens of prevention is thinking about what are those early life exposures and the context in which people live that are really important as we think about risk and protective factors. So many of you may be familiar with adverse childhood experiences. These are essentially experiences that happen up to the age of 18 that have profound impacts on substance use risk, on mental health risk, suicide risk, other chronic diseases, development later in life. And these are the more traditionally defined ACEs here. But other factors like violence in a community or school, experiencing bullying, experiencing instability, homelessness, food insecurity, can all play out similarly to the more traditionally defined adverse childhood experiences. And we see in the data very consistently that kids who've experienced ACEs or trauma have much greater risk for substance use, regardless of what substance is looked at. And then I think more recently, we really understand the connection between social determinants of health or social drivers of health and substance use risk. And honestly, if we start our prevention work in middle school, we're really too late. There are certainly opportunities there, but we have to think about how are we getting even more upstream? How are we changing that context in individuals, homes, in families, and communities to address these broader factors that play out in someone's life? Just one slide to talk about the connection between ACEs and substance use. Again, as people experience ACEs and certainly multiple ACEs, we see extraordinarily high risk for using different substances or different ways of using substances like injecting drugs. And again, there are reams of research papers over the last several decades that have documented this very well, whether it's opioids, prescription opioids, illicit opioids, stimulants, use disorder, injection. We see this consistent relationship with ACEs. And we see it similar for mental health and suicide as well. Like I said, we're learning more around social determinants of health and its impact on substance use and overdose. This was a recent paper that looked at county level overdose deaths and social determinants of health. And they found that areas that had greater levels of social vulnerability, violent crime, less income, less access to healthcare, less access to the internet were all associated with increased risk for drug overdose. For those communities that had lower vacancies in housing, they actually had lower risk for drug overdose. Again, we have to think about this not just at the individual level and focusing on use, but what else is happening in their life and in their community, and how are we addressing that from a prevention standpoint? And I think this sort of socio-ecological model is a helpful way to think about how can we as a prevention field, regardless of where you sit, in a healthcare setting, in a community setting, education, criminal justice, public safety, we all can be doing something in each of these spaces, or certainly concentrated in certain spaces, to address risk factors at the individual level, at the relationship level, at the community level, or at the society level. There are opportunities. And if we only focus on one of these areas, say like at the individual level, we're never going to make the progress that we want to make. We really need to focus on these things in tandem. And sort of the flip side of all of this is sort of the protective factors. So building individual, family, and community resilience, promoting positive situational, social, and individual characteristics. How are we helping support healthy development and social emotional competencies, the presence of positive relationships, and safe, productive, and equitable environments? That's really what we are aiming to do. So I want to just go through each of those areas and provide a couple of examples of different prevention strategies that really target those individual, family, community, and society risk factors. So here are the risk factors in red on the left, and then prevention strategies. So again, this is really more focused on the individual or maybe small group activities. And I think this is where people think of more traditional substance use prevention programming. So things like life skills training, problem solving, conflict resolution training, things like strengthening families program, life skills, good behavior game, many of the programs that schools or communities implement. Ultimately, the strategies here are about building resilience, creating empowerment opportunities, exposing youth to positive adult role models, and ultimately raising awareness about risk of substance use and overdose. And then certainly, given the connection that we know around underlying mental health challenges and substance use, making sure that we're addressing those challenges, especially if they present early in adolescence. At the family, and so an example of an individual strategy that also hits a little bit on the family side as well is the Prosper delivery system, which was a sort of multi-component approach to addressing substance use risk. And these are data from a randomized trial that looked at the Strengthening Families program 10 to 14 when kids were in 6th grade. And then they did life skills training in 7th grade. So Strengthening Families is more about working with parents and kids to strengthen relationships, set boundaries, healthy communication. So you're trying to work on how are kids and parents interacting together in a positive and healthy way. So they did that in 6th grade. And then in 7th grade, they did life skills training, which is more of an individual level intervention, working through problem solving, how to handle emotions, deal with conflict, have healthy relationships. And so again, these were interventions that were done in 6th and 7th grade. They then followed these kids up to the age of 19. And they found that those interventions, which were done in 6th and 7th grade, resulted in significant reductions in rates of substance use at age 19. Again, interventions done at 12 or 13 had lasting protective effects for kids, really across a range of substances. There are other studies that have looked at this same intervention that followed the kids up into even their mid-20s that found similarly protective effects at reducing risk for substance use. So again, really speaks to the power of prevention. If we're setting kids up for success early in life with life skills, with positive parenting, it can have a lasting protective effect. And more sort of on the clinical side, we know that exposure to potentially addictive substances, especially early in life, can increase the risk for substance use. And certainly that played out very clearly with opioid prescribing, large increases in opioid prescribing that translated to rises in overdose deaths and opioid use disorder in the mid to late 1990s through the 2000s. So how we approach pain management is really important. And thinking about it, again, in a patient-centered way, recognizing that there is a role for opioids, but we want to make sure that opioids are the right medication to be used for patients. So CDC released new guidelines in 2022 that provide information around acute, subacute, and chronic pain for adults age 18 or older, not including cancer-related pain, sickle cell, terminal care, palliative care, end-of-life care. So I think it's a fairly straightforward guideline about how to approach people who are initiating or potentially initiating opioids, people who've been on opioids for a long time. How do you address challenges that they may be experiencing? And then what are the alternatives, non-pharmacological treatments, pharmacological treatments that may be more beneficial for patients depending on their underlying pain conditions. I'll also note that the American Academy of Pediatrics also released, I think just earlier this week or late last week, a new pain treatment guideline for young people, which really had not existed before. So if you're treating adolescent patients who have pain, I think that's a really important new resource to help guide clinical decision making. So at the relationship level, again, we're thinking beyond the individual, but how are they interacting within their family or other caregivers? So again, this is about healthy relationship building, creating opportunities for positive social involvement with their family, instilling positive parenting programming and skills for parents, which is, again, we know, especially among younger people, parents are probably the most important influencer in somebody's life. But how are we equipping them to navigate what their kids are facing in 2024? I have an 11-year-old. She just started middle school. I didn't get a handbook on how to navigate all of those things, right? I need support as a parent of like, what are age-appropriate conversations? How do we talk to kids about substance use? How do we talk to kids about bullying and developing healthy relationships and not falling into unhealthy patterns? It's really important for that developmental process for kids to support parents in positive parenting. So again, there are a variety of programmatic interventions that have been well studied for supporting parents. And then, of course, addressing other household challenges that contribute to stress or other risk factors. And if there's underlying parental substance use or mental health challenges, we want to make sure that we're addressing that as part of the sort of continuum of care. Just a couple of examples in the family area. Is a program called the Nurse Family Partnership. It's a home visitation program that essentially is trying to set families up for success very early in life. The first couple of years of life, a nurse in this case helps to navigate medical, health, social needs for expecting parents, and then works with them over the first 2 years of life. What I love about the evidence around this program is that they followed families that were part of this intervention in a randomized trial over a 15-year period, and they found that, again, parents who were part of the intervention had less challenges themselves, but even among their kids, had less substance use, less other sort of internalizing disorders, other issues with academic achievement into their teenage years, even though the intervention was just in the first couple of years of life. So again, it speaks to the opportunities for prevention. And many people may not think of this as a substance use prevention program. People might think of it as a program to address child abuse and neglect or child maltreatment, but it certainly has a benefit to substance use. And then certainly on the more acute side, we know that many people who could benefit from life-saving medications for opioid use disorder or naloxone or behavioral health services do not get them. This is from a study we did that came out a couple of months ago and just really speaks to the power of these interventions. So for people who got methadone, their odds of dying a year after a non-fatal overdose were 58% lower than people who did not get methadone. It's 52% if you got buprenorphine. If you got a prescription for naloxone, your odds of dying were 30% lower after a non-fatal overdose. So again, we know these things work even in a fentanyl context, but we certainly need to expand access to them. At the school and community level, again, we're sort of building out beyond individuals, families, but thinking about the broader school and community. And again, creating opportunities for positive social involvement with school and community, positive supportive school environments and policies. How are we engaging and identifying students early who may be struggling, and how are we helping to support them? Raising awareness in the community about substance use and impacts, promoting drug checking and awareness about toxicity, counterfeit pills in the community, taking on efforts around promoting help seeking, combating stigma, and then thinking about access to healthcare, behavioral health, overdose reversal medication. So sort of starting to think about some of those social determinants as well. And this is just one example of the Communities That Care model, which is, again, sort of a holistic community school approach to prevention. Again, following people out over many, many years, we find that those who are part of this intervention have reduced rates of substance use across a variety of substances, as well as other risk behaviors. And then at the broadest level, the society level, again, this is really where we think about the bigger P policies. How are we thinking about strengthening economic supports for individuals and families, improving access to education, to housing, to early childcare, food security policies, really thinking about those social drivers, the social determinants. And then what are the societal norms around substance use? How are we talking about substance use and risk that's associated with substance use? So just one example here of a recent study that looked at the SNAP benefits, the Supplemental Nutrition Assistance Program. And again, many people may not think of SNAP as a substance use prevention policy, but what they looked at is at the state level, for states that had more flexibility with their SNAP programs, more generosity of their SNAP programs, actually had lower rates of alcohol use disorder, other substance use disorders. And so again, it really speaks to how are we building our table of prevention partners to address some of those underlying root causes. Lifting people out of poverty is an important component of thinking about reducing risk factors and promoting protective factors. So at SAMHSA, we have a variety of programs that are helping to support this broader ecosystem of prevention across the continuum of care. In the interest of time, I'm not going to go through all of these things, but we have very large investments like our block grant and SOAR funds, and then more targeted investments to both states and communities for prevention, for overdose training, response, naloxone, opioid overdose reversal, distribution, as well as more targeted programs for different populations. One resource that I did want to highlight is that given the connection between social determinants and substance use, if you're working in this space, we created a digital resource to help educate people on social determinants and substance use, and to think about in the prevention work that you're doing, how can you incorporate information and activities related to social determinants into your prevention toolkit. We also have the Talk They Hear You campaign. It's been around for over 10 years. And again, as I mentioned in the earlier data slides, about half of 12 to 17-year-olds in the US said their parents talked to them about substance use. Well, one of the reasons we know parents don't talk to their kids is because they don't know what to say. They don't know how to approach that conversation. So this campaign is really about helping parents, teachers, educators, other caregivers get informed, be prepared, and take action, including starter videos to how to have a conversation. There's mobile apps that can help parents talk to kids and engage in their community through things like Communities That Care, Parents Night Out. So again, this is a free resource for everybody. So if you're doing work with parents, this is a great resource. You don't have to create it. It's already been created. It can be helpful in helping to jumpstart those really important conversations of adult influencers with kids. We also have Screen for Success, which is a brief screening tool, again, to help jumpstart conversations. It asks questions around health, wellness, and well-being. So if you're concerned about somebody or your kid says, you know, I'm just not feeling myself, I'm not interested in the things that I used to be interested in, this is a sort of standardized screener that can help you as a parent or adult caregiver have that conversation with your kid, really understand what's going on and what resources, both locally and nationally, are available to help find higher levels of support if that is needed. So again, this is a free resource. We're now launching this with health professionals so that they can use it as a screening tool as well. And then the last two resources, and again, we'll make the slides available for more details, but I want to make sure we have some time for questions. We released an updated overdose prevention and response toolkit back in January, which includes the latest information on overdose trends, as well as the variety of opioid overdose reversal medications that have come out and that are available in communities, whether that's prescription products, over-the-counter products, different formulations, traditional doses, higher doses. We really wanted to provide as much information as possible so people can make informed decisions about their overdose prevention and response work. We broke this toolkit into 5 areas. So information for people who use drugs, information for people who take prescription opioids for pain, practitioners and health systems, first responders, and then sort of broader policy and systems considerations. We have a Spanish version of this toolkit as well, and the QR code will take you to that on the SAMHSA website. These are just examples of some of the tables that are included. Again, sort of detailed information about the different types of reversal agents that are available, as well as sort of there are very practical tips and strategies for reducing risk. And we do have a specific section for practitioners and health systems, and again, incorporating ideas of motivational interviewing, prescribing medications for opioid use disorder, that the acute overdose reversal is just one step in the process of saving a life. And then the last thing I'll highlight is that we released a harm reduction framework around the same time, which is really the first time that SAMHSA has defined what harm reduction is, with a set of sort of practices, principles, and pillars about how we can operationalize harm reduction across the behavioral health continuum. Here are some of the core practice areas. And again, I think wherever you're sitting, showing up and engaging with people with empathy, dignity, respect, recognizing that all human life has value is a harm reduction approach. Whether you're in a clinical space or a community space, we can all show up and treat people in that way. But then there are other ways to think about sort of how are we engaging with individuals. And in SAMHSA's grants, we are expanding things like naloxone and opioid overdose reversal medications, test strips, syringe services, overdose prevention and response education, et cetera, as a way to sort of mobilize harm reduction activities within our grant programs. We've also released an advisory around low barrier models of care for substance use disorder, in particular looking at medications, because we know that so many people who could benefit are not benefiting from those medications. And I'll close with just saying we really are at such an important time. We're seeing trends go in the direction that we want for most areas in the country. Certainly, we're seeing that for substance use prevention, but there is so much more work to do. And we have to be nimble in our response, be informed by the voices and experience of the communities that we serve, and look at it in comprehensive and holistic ways. We can't just operate in one little area. We have to think about individuals, families, community, and the whole society. And what are the levers across those areas that we have to pull to advance prevention work, to help realize that future where individuals are and communities are healthy and thriving. So thank you very much. I know I went through that fairly quickly, but hopefully we have some time for questions. And like I said, I'll make the slides available.
Oh, thank you so much. It's always wonderful to sit in one of your presentations or to be part of one of the presentations because they're so comprehensive and the resources and information that you share. So we're so thankful for your presentation today. I know we have a little bit of time for some questions, and they're kind of coming in, but first, I know you talked about society level strategies, and we just have someone just asked, could you just maybe highlight one or two that you would pull out? I know we were kind of going through some of those slides a little bit quicker, but what would you say would be the top priorities of someone who's looking at exploring that?
Yeah, I mean, I definitely think looking at sort of the policy side of this, like SNAP benefits, child tax credit, earned income tax credit, things that are sort of shoring up economic stressors. We know that that instability in somebody's life can play out both directly and indirectly for substance use risk. One, we know that stressors for parents could lead to, increase or initiating substance use, which has a negative impact on the next generation. We know that economic stressors can increase risk for suicide. So loss of a parent is also a risk factor. And it can also play out in ways of like child abuse and neglect or child maltreatment. So I think that those are really potent levers that we've not necessarily thought about in the substance use space. They've been applied in other areas of public health, but I actually think, part of what I love about prevention is that everybody's got something. Everybody can play a role. And so it's helping other people who have those levers, whether it's at the state level policymakers, federal policymakers, or local policymakers. If you care about overdose, if you care about youth mental health and substance use, here are things that you can do to address these sort of root drivers. So I would say those types of economics policies could be quite powerful, right? They're going to reach more people than an individual level intervention.
No, I think that's important. And also, I guess the question is, what do you think maybe holds back prevention strategies? Could it be stigma or funding? Like, what are the things, the barriers that we can work to address?
Certainly, stigma is highly pervasive. So I think that is something that should always be front and center of just like having those brave folks who can talk about it. I think people don't want to admit that substance use happens. That, my own experience, I went into treatment when I was 21. My first year of pharmacy school, I'm a person in long-term recovery, but like we didn't talk about it. Where I grew up, it was an unspoken thing. But as soon as my parents' kids and my parents' friends found out about me going to treatment, it was sort of like the dam broke. And everybody was like, oh my gosh, my kid is struggling as well. Will Chris talk to them? And so I think like having those conversations, making it very personal and being willing to have those conversations is a really important way to combat stigma. I think the other challenge is resources. Prevention has been flat funded for many, many years, despite a lot of money coming from the federal government to support overdose and mental health. Very little of it has been specific for prevention. And, it's totally appropriate that we need to expand access to treatment and downstream consequences. We need to do that because we were experiencing extraordinarily high rates of overdose. But if we don't also make investments upstream, we're going to continue to get some of those downstream consequences. And just as an example, we have a discretionary program that funds states and communities. This past year, we got about 350 applications for that program. We had money to support 42 awards. So to me, it really says there are communities who are ready. They're ready for action. They're ready to do prevention. We just don't have the resources to support it.
Well, I see that the chat is very grateful, the preventionists who are there, who are with us today, for you pointing that out, because I know prevention is oftentimes not seen as something, that we can back up. And so the funding opportunities are sometimes smaller. I know we're coming to the end of our time. The poll has went up, and I appreciate everyone who was able to give us some feedback on today's presentation. Dr. Jones, I just want to turn it back over to you just for a minute, is just to leave a final message or note to all of our attendees. As you know, we have a varied group with us today, and one last thought to leave with them.
I would say one thing to know is that prevention works. We have decades of prevention science and community-based and practice-based experience that continue to show that what we're doing is important, that it works. And I would say the other part is just find what that prevention is for you, wherever you are, whether it's just engaging with young people, engaging with parents, you're working at a clinical or health system level. Find those opportunities for prevention. They exist throughout your community. So step up. It is not hard for me to wake up in the morning and go to work. Like, who doesn't want to have a future where individuals, families, and communities are healthy and thriving? So join the team. Engage in this work. It can be small or it can be really large. We need everybody to sort of pull all the levers that they have. So just thank you for everything that you're doing.
No, you know what? I think that I love that idea of pulling the levers. That it's a great metaphor. I just want to mention that again, October 6th and throughout the month of October in New Jersey, we're really putting a focus on this. There are free resources available. There's information in the chat on how you can get those resources. We'll share the resources that Dr. Jones shared today in the PowerPoint slides, all the SAMHSA resources. They all look amazing, the app, all of that information. Parent education is so important. You mentioned it. We'll make sure we share that information. In New Jersey, we have some parent education free resources available as well. You'll get all of that information in your post-webinar email. Again, I want to thank everyone for joining us. I want to thank Dr. Jones. Amazing presentation. Thank you so much for all the information. I hope everyone can join us next month, November 14th, as we look at building resiliency among professionals, healthcare professionals, preventionists, treatment. We know we're all kind of facing a bit of a burnout. And so I hope you will join us on November 14th as we talk about that. And also for your continuing education credit, you can visit the link on the screen, knockoutday.drugfreenj.org/October 3rd. Thank you again for all our attendees. Thank you, Dr. Jones, and everyone. Be well. Have a good day.